Hi kids, I'm Christina Goode of Goode Entertainment. I'm making these ASMR role plays to show children that the healthcare setting does not have to be scary. It can be pretty relaxing and therapeutic at the same time. I also am a trained healthcare professional as a clinical medical assistant, so I've got my scrubs on right now, and so I have some knowledge of the medical setting. I am I am also filming in an RV because since nobody is living out here in the RV, and we thought my bedroom was a bad idea, I decided to record over here. Now, I know that we are in the middle of a triple-demic right now with flu, COVID, and RSV. I do want to let y'all know that kids, if you're watching this, make sure you wash your hands regularly, and to always make sure that if you are feeling sick, just stay home and tell your parents. And that is really the best that we can do. Also, I do recommend getting vaccinated for flu and or COVID, so that if you do catch COVID or flu, it should be easier to fight the infection. Now, for this role play, a subscriber of mine has asked me to do a excuse me, has asked me to do a role play about a child with pneumonia. What is pneumonia? It is a very serious lung infection caused by some mucus buildup in the lungs. Common symptoms are fever, chills, raspy breathing, of course. They also experience chest pain while they're breathing because it's so hard for them to breathe. So, and sometimes they will develop a cough, and sometimes that could give them a sore throat. Now, I have these kinds of scrubs on because I am doing an emergency room role play. Now, also known as the ER. The ER is a very stressful work environment because there's always staff and nurses and doctors going back and forth trying to treat patients, and it's a lot of stressful things happen in the ER, because personally I've been in the ER. It is not fun at all. So so this role play may seem a bit rushed for some of you kids, but really I gotta really show you what it would be like if you were in the ER with pneumonia. So, enough about that. Let's get right into the role play. Hi, my name is Christina. I'll be your emergency room physician. So, I see here that you have some pretty serious respiratory symptoms. Yeah, and you got your mom over here to help you. Now, when did these symptoms start? Okay. Do you know if they had the flu beforehand? No? Okay. Now, let me take a look at your vital signs here before I do my short exam. Okay, it looks like we did some lab work. So your vital signs, you had a pretty high fever, 102.4, and your heart rate was a little bit elevated. I'm pretty sure that's because you're nervous. Well, you don't have to be. There's nothing you should worry about, okay? Your blood pressure was also a little bit elevated, also suggesting that it's because of nerves. Your oxygen levels were a little bit low over in the 80s. That's interesting to know. This actually sounds like it could be pneumonia, which is not that common. Do you mind if I sit beside you? Perfect. Now, what pneumonia is? It's a very serious lung infection. That's probably what you have, but you shouldn't worry about it. It should clear up in about 2 or 3 weeks. We're actually going to keep you here at the hospital to help you out here. Okay? All right. Now, you do my short exam. I have to be quick about this because being in the ER is it's a very stressful work environment. First thing I'm going to do is I'm just going to take a listen. Can you give me a few deep breaths for me? Again. Perfect. Again. Good. One last time. Okay. I was hearing a bit of raspiness. I was expecting that. Gonna feel your belly here. You tell me if it hurts, okay? Doesn't hurt? Okay, good. I'm gonna feel alongside your neck. Lymph nodes are a little swollen. I was expecting that. It's nothing for you to worry about, okay? I'm gonna have you just open your mouth, stick out your tongue, and say ah. Good. I see. You have a little bit of a sore throat. Your throat is a little bit red. You have you been coughing a bit? Okay, just a little. And does your throat hurt? Okay. A little bit of a sore throat. Does that hurt whenever you're breathing? Okay. So I would also like to take a look at your eyes. So this is going to be a little bit bright, okay? So just stare right at my nose. Okay, that eye looks good. And that eye looks good as well. Turn off, you. Has a mind of its own. That happens quite often. Well, your eyes were not affected by by the illness. I'm going to feel around your head. You've been experiencing some headaches? Yeah, a little bit? Okay. Alright. So this is definitely sounding like a bit of a pneumonia. So nothing, like I said, nothing you should be worried about, okay? It should go away in a couple weeks, and either way, we're gonna send you over to the pediatric inpatient unit, but we're gonna wait until the results come back, okay? All right then. So now, what I'm going to do is I'm going to put in an order for a chest X-ray so that we can see a little bit more in detail about your lungs and what's going on in there. We're going to determine to see if this was caused by either bacteria or a virus. Yeah, I'll explain a bit more to you later, but I gotta go cure another patient, so there will be a nurse coming in a little bit later to do the chest X-ray, and when I get back, that's when your results should be showing. Okay. All right. I'll be back later. You just get some rest. Hi, it's me again. So, we got your results here. It is showing, well, before I tell you what it is exactly, I'm going to tell you a bit more about treating pneumonia. So what it is basically is, like I said, it's actually mucus build up in the lungs, and it can really obstruct your airway, causing the wheeziness. But there's nothing you should worry about, okay? Okay. Now, if it was caused by a bacteria, then we would classify that as a bacterial infection. What we would do is prescribe you some antibiotics to support the immune system to clear up all the mucus. But either way, you're still going to have to remain in bed for at least 2 weeks. So, bacterial infection is pretty easy to treat. If it was caused by a virus, the only thing we could do is prescribe you some pain medications to help you with your chest pain. Okay? Now, on with the results. We've determined that this was caused by a virus. So, like I said, we're going to give you some pain medications for the chest pain. We are also going to admit you into the pediatric inpatient unit. There, another doctor will be assigned to you, as well as many other health professionals. You'll be assigned a registered nurse, maybe even a pediatric social worker, a case manager, a child life specialist. Those are really fun. You will also be seen by a respiratory therapist to make sure that your lungs are clearing up. Now, I want to tell you some of the things about the unit. There is one area for your parent or caregiver to sleep with you. We do recommend that no visitors under 18 spend the night, just for safety reasons. But your family and friends can still visit you. They will just have to register and get a sign in and get a visitor's pass at the entrance. Excuse me. Excuse me. So, with that in mind, a nurse will be a nurse from the unit will be here momentarily to escort you over to the unit, and you will get your own bed. Your parents can have their own sofa sleeper, and you will also have a private bathroom that includes a toilet, a sink, and a shower. You will also have a TV to keep yourself entertained. So, we are here to support you no matter what, okay? Alright, well, you just get some more rest, and like I said, a nurse from the unit will be with you shortly to transfer you over to the unit. And I hope you have a good stay, and try and have a better rest of your day, okay? Alright. You'll get better. I know you will. Okay. I'm gonna head out now. Bye. Hi kids, I hope you enjoyed that roleplay. Now, the next ASMR roleplay will be the what I was just speaking about earlier, about a nurse from the unit escorting the patient over into the pediatric inpatient unit and putting them in their own room, in their own bed. And so I'll be back with that role play right there. So I'll see you kids next time. Keep that popcorn with you.